And hello everyone, and welcome to this audio podcast as part of a Biome edition. This audio podcast as part of a Phantom Newscast. This audio podcast as part of a Lobostics Vortex, and this audio podcast as part of a Storm Lobostics production. Today looking at a research poster presentation, that was within the remit of the British Blood and Transfusion Society, or BBTS, in around 2017. In around 2017, the research poster presentation excuse me, the research poster presentation was within the remit, or had the theme in around education, leadership and management. The research poster presentation the research poster presentation was and had the main the heading, the need to consider renal health in transfusion care, and research to inform best practice. And this research poster presentation was collaborative, wherein there was a collaboration between an NHS trust in the southwest region of the United Kingdom, and also the social media platform, the Renal Patient Support Group, the RPSG. So some aims as part of this research poster presentation. So initially, to provide practical context of leadership and management in transfusion care and practices. Excuse me. Secondly, to understand what further practical care is required for patients or recipients with long-standing conditions and chronic illnesses. Throughout the research poster presentation, abbreviations for long-term conditions, or LTCs, and LTCs is used, and for chronic illnesses, CIs or CIs is used. And then three to highlight what practices would support the development of transfusion care guidelines, and four, to provide an understanding of treatment alternatives taking renal insufficiency into consideration. So a little bit of background to this. So most recipients aged 65 and over can have, or may have multi-morbidities, although one investigation had found that absolute number of patients or recipients with multimorbidity is higher in those aged under 65, indicating its implications for the population or populations as a whole. And so between 2010 and 2030, it had been estimated that a number of younger adults with LTCs or CIs, so those aged between 18 to 64, will increase just over 32%, from around 220,000 to around 290,000, and the number of younger adults with physical and sensory impairments by 7.5%, from almost 2,900,000 to 3,100,000. And furthermore, rates of a lot of LTCs and CIs are increasing, have been increasing at the same time due to population population aging, and amongst other causes. There are no universally accepted there are no universally sort of accepted guidelines for managing transfusion care in recipients of patients with LTCs or CIs. With LTCs and or CIs. That being said, there are guidelines on guidelines within transfusion practices, transfusion and hematology practices that are specific and aligned to particular standard operating procedures according to different regions of NHS trusts within the United Kingdom. And practice differs between hospitals, regions, and countries at the same time. So transfusion practices have been developing, incorporating many novel pharmacological agents into care in view of the potential longer term risks and side effects of red blood cell transfusions. And there is ever more, or there have been ever more, sort of a need to consider that renal health of recipients who require transfusion care, especially since renal function is important in the synthesis of the hormone erythropoietin or EPO, and where renal insufficiency is evident, and this can be the difference between morbidity and mortality. So a look at CKD as part of this poster presentation from 2017. So CKD is or has been increasingly being has been increasing because has been increasingly been recognized in amongst particular in amongst particular in amongst particular aspects of healthcare practices, and as a global public health issue, and a main sort of determinant of poor health outcomes. There is more compelling evidence that disadvantaged communities, for example, those from low resource, racial and minority and ethnic communities, for example, and or indigenous and those amongst socially disadvantaged backgrounds, suffer from marked increases in the burden of unrecognized and untreated CKD. Where I mentioned where the terminology untreated CKD is concerned, listeners, is to inform that untreated is in context of coding, in line to electronic patient records. Untreated CKD could be and can be aligned to uncoded CKD. Although the entire populations of some low and middle income countries could be considered disadvantaged, additional factors pose a position of extreme disadvantage for certain populations and groups. So, for example, those living in some rural areas, sort of pediatric and young population, females, female population, and the elderly, and the elderly population, etc. The fact that the fact that even in developed countries CKD has increased, and outcomes suggest that there is much more to learn beyond the traditional risk factors contributed to this irreversible CI and associated complications. So now looking why as part of this poster presentation from 2017, in regard to why consider renal health in all recipients or in all patients. So from a practice perspective, excuse me, from a practice perspective, this is usually a very important question that all healthcare scientists and scientists within pathology and laboratory medicine, and within transfusion, and particularly within transfusion practices, sort of particularly ask, and if not asking, or sort of pondering on, um, um, uh, um, if not asking, or pondering on, then should be asking or pondering on sort of more routinely. So considering renal health and blood physiology of recipients and patients who may require red blood cell transfusions in sort of prospectively is sort of main to achieving best practice, and more so now than ever, not least because CKD incidences or prevalences have been increasing, but also because transfusing patients or recipients with reduced estimated glomerular filtration rate, or GFR, or renal function, or recipients or patients with a CI or chronic illness, or with a CI or LTC, can further compromise renal function over time. And so with renal function decline, this has an impact on overall treatment and care plans, and patients then potentially patients or recipients then becoming more complex, and these are the all cause mortality rate in CKD is evidence 30 to 60 times higher than in the general population. So scientists or healthcare scientists and clinical scientists and teams now need to sort of question what are the clinical implications for transfusion for transfusing and the and also the leadership and management decisions needed to transfuse safely, if at all. So now, in this poster presentation, a look at sort of in part answering in on the question in regard to the decisions needed to transfuse safely, if at all. So a better now looking at sort of clinical factors and decisions to transfuse. So a better understanding of the risks of transfusion has transformed red blood cell transfusion medicine through the accelerated development of more sophisticated donor testing. So for example, improving sort of infectious disease investigations, pre-transfusing testing, recipient identification, and multiple improvements in blood component characteristics and quality. So for example, irradiation and pathogen inactivation. So the developments have resulted in improved safety profiles for transfused components, and the perception of minimal risk. At the same time, the introduction of patient or recipient blood management, or wherein transfusion practices sort of again specifically specifically blood management is referred to as patient blood management, or PBM, and defined as an evidence-based approach to optimizing the care of recipients or patients who might require transfusion shows that the need for transfusion can be minimized in many recipients or patients by implementation of thoughtful processes, often beginning days or even weeks before the actual decision to transfuse an actual decision to transfuse or not is being made. So now looking at some strategies, some strategies for transfusion therapy or transfusion regarding therapy. So although partial anemia correction with erythropoietin stimulating formulations, or EPO stimulating formulations provide various advantages to normalize hemoglobin levels, however, can be associated with cardiovascular and cancer risks. There is a general agreement, general consensus that red blood cell transfusions are not typically indicated for hemoglobin levels of more than 100 grams per deciliter. 100 grams per liter, and transfusion should be considered when hemoglobin is less than 70 to 80 grams per liter, depending on patient characteristics. Quality monitoring and compatibility screening otherwise helps specialists sort of laboratory teams to ensure a high level of safety for patients, high level of safety for patients and receiving a transfusion therapy. It is not. It is important. It is important to note at the same time that lowering the hemoglobin threshold at which blood is transfused can potentially reduce the need for red blood cell transfusion, and this is not associated with an increased morbidity or mortality amongst most critically ill recipients or patients. More adverse effects of red blood cell transfusions have been evidenced and informed within the literature. So now looking at managing anemia amongst the chronically ill, and also complex in complex care patients or recipients. So reducing the number of inappropriate and borderline transfusions from 80 from anything from, for example, around 80% to 30% reduces reduces patient risk of adverse transfusion outcomes, such as transfusion associated lung injury. And to inform here listeners that transfusion associated lung injury transfusion associated lung injury amongst the literature, and again in amongst transfusion based guidelines, the abbreviation TRALI is used and 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 additionally Charlie is concerned, uh, a transfusion associated circulatory overload, or TACO, is also synonymous and so uh, and so um, and so uh, and so again, reducing the number of inappropriate and borderline transfusions, and transfusions, as well as sort of the effects that bring that can propagate trolley and transfusion associated circulatory overload, or TACO, as well as transfusion reactions, formation of antibodies, and so on, is part of transfusion 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 care and practices. As the sort of data in amongst literature has been had had been had been sort of evidence to inform of patients of patient outcomes patient outcomes. It is also paramount to truly measure the success rate the success of appropriate red blood cell transfusion prescribing. So presently work has been outside the parameters of quality indicator projects or works. For example, prospectively, however, further audit and research into morbidity and mortality before and following guidelines in would and following guidelines would provide information would provide more basis on patient and recipient outcomes. Sustaining reduction would require ongoing work to highlight evidence-based data, work that may be both work that within transfusion practices are both can be both and tend to be both important and also like to sort of looking at aspects of effectiveness. Simple tools to aid clinical decisions can also be invaluable. Research to understand and identify suitable alternatives and indications to red blood cell transfusions for recipients or patients with LTCs and CIs has become important more now more now than has been in the past decade or so. And the clinical factors to appreciate renal health generally also need a sort of a reputable standing. So now looking at sort of leadership and management. So there is still a requirement to appreciate what further aspects of care are required for recipients or patients with LTCs and CIs in sort of from a broader perspective. And there is a need to highlight what specific practices would help in the development of transfusion care guidelines, and where healthcare scientists or scientists need to gain a more grasp of understanding of treatment alternatives, taking into consideration into consideration renal insufficiency, renal insufficiency. An evidence-based recommendation for change in practice should also include a pathway to support and develop future healthcare scientists, but also in regard to develop future frontline healthcare professionals, future frontline healthcare professionals, leaders and managers, thus bringing practices more practice more to the forefront, where transfusion and transfusion and hematological conditions and LTCs and CIs and where LTCs and CIs are concerned. So scientists are needed. Scientists are required and needed, who can contribute through multidisciplinary team efforts, clinical and laboratory, using evidence-based understanding, thus prompting practice to become prompting practice to become more evidenced. This should shift the paradigm of leadership and management, wherein prospective leaders challenge the status quo, and to inspire and persuade frontline staff colleagues and staff colleagues and staff and colleagues and healthcare professionals. Managers are also managers are also needing context of transfusion practices to prompt developing and maintaining a smooth workplace, encouraging compassion through the delivery of service and mentorship. Now looking at some looking at some as part of this poster presentation, some aspects of discussion and then conclusions. So scientists make healthcare scientists or scientists amongst pathology make decisions and interpretations based on request in front of them, and by acknowledging how a clinical team might be caring for a recipient or patient in the short term. However, in relating scientists also should become more acquainted with clinical and medical parameters of conditions or disease, to understand what forms of treatment would be best for longer term trajectory and future care plans. There needs to be at the same time there needs to be more studies or investigations in amongst laboratory medicine, so practices become more tailor-made for recipients or patients. That's to inform at the same time, listeners. That's not to say or not to say that in certain aspects of laboratory medicine for recipients, for patients, some aspects of practices are tailor-made, since there are patients and recipients, for example, out there that for example are well known amongst particular and specific specialties amongst frontline practices, and frontline practices and amongst laboratory and pathology. So inside with this and where aspects of tailor-made is, and tailor-made is in this context, listeners, is aligned to antigen, looking at antigen and antibody sort of aspects in ensuring that recipients who as part of as part of as part of particular sort of hematological and transfusion syndromes, that recipients are appropriately and applicably sort of sort of tissue typed, or also cross match in context of uh, where transfusion and blood and blood is and may be required. So in this context, additionally, phenotyping is a form of a form of scientific and also a sort of a laboratory sort of procedure that allows sort of recipient and donor sort of cross matching to applicably ensure that sort of the not only, so for example, not only the correct sort of blood group in context of where blood requests are fulfilled, but also ensuring that any additional antibodies are sort of excluded, thus not propagating any issues when recipients or patients have a blood have blood as part of as part have sort of blood as part of their as part of their sort of hematological or hematological LTC or CI sort of condition. So it is one way. Phenotyping is one way that could help and can help match patients or recipients with a suspect renal insufficiency or renal impairment sort of in additionally. So all NHS trusts need to sort of or need or should look to look to sort of feed into a main hub of what works and what doesn't, and when it comes to transfusion care for patients or recipients with LTCs or CIs. Healthcare scientists and sort of laboratory practitioners excuse me, also need to be involved in raising awareness and providing sort of education to clinical and medical teams of the more intricacy and laboratory practice of the more intricacy of laboratory practice, but also highlight what treatment alternatives there are that will preserve renal function over time. Thus, proactive scientists, and laboratory specialists are required excuse me are required who know the more multifaceted nature of CKD of conditions such as CKD or chronic kidney disease, amongst other sort of renal other forms of renal conditions that can affect hemoglobin and can prompt the symptomologies in around anemia or low hemoglobin. So there is no reason why healthcare scientists and laboratory staff can and should not be involved in for example multidisciplinary team meetings, and this also allows and this also follows a leadership follows a sort of a leadership basis. In practice, our scientists should be having discussions with medical colleagues, medical and clinical colleagues, so that they too are aware of the advantages and disadvantages in the more multifaceted prescriptions that are linked to that are part of red blood cell transfusion. Now looking at sort of the conclusions, listeners, around this poster presentation. So healthcare scientists or scientists generally have more of an active and sort of broader role to play with regard to proposing and to postulating and informing potential frameworks and guidelines and working collaboratively and contributing through varying organizations varying organizations where laboratory medicine and pathology is concerned. So, for example, the British Blood Transfusion Society, the British Blood Transfusion Society, and through where the British Blood Transfusion Society has specialist interest groups, for example. And so this has become more apparent and evidenced, and where evidence-based practices need to be part of as part of routine, and this will and should help continuous development, especially where healthcare scientists and laboratory specialists look to understand the broader basis relating to best practicing, the broader picture in regard to and relating to best practices. Scientists with transfusion expertise and with leadership sort of aptitude will be required to enhance the importance of understanding renal health and sensitivity of laboratory tests through multidisciplinary team efforts. Modern laboratory practices are now extending leadership functions across departments, departments and teams in most organizations. Good management will thus also require input from colleagues, for example, colleagues and amongst laboratory medicine and laboratory medicine and pathology in most sorry in at all level to achieve a formal sort of consensus and help to help form to help form transfu more to help inform renal focused guidelines. Patient blood management will become more important in transfusion practices. Thus, care is and has been moving towards patient-centered approaches, almost 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 like but not quite like personalized medicine. So scientists need to or should take ownership to ensure safe and quality assured practices. That to ensure safe and quality assured practices as part of transfusion care. And there is and at the same time where there is a sense of interactivity at every level, allowing all to voice concerns when required. In around almost a decade ago now, the um, the um, the National Blood Transfusion Committee in around 2014 informed that transfuse one dose of blood component at a time, for example, 1 unit of red blood cells or platelets in non-bleeding patients, and reassess patient clinically and with further hemoglobin count to determine if further transfusion is needed. And so this will help, or should this will help management in recipients of patients who have known for example, have sort of known renal impairment or renal insufficiency. So that draws this audio podcast to a close. This audio podcast as part of a Biome edition. This audio podcast as part of a Phantom Newscast. This audio podcast as part of a Lobostics Vortex. And this audio podcast as part of a Storm Lobostics production. And to inform as well, listeners, there will be the sort of references aligned to this poster presentation on and as part of this audio podcast in on social media so that listeners can look to identify sort of literature relating and regarding to this works, and in regarding to sort of laboratory and pathology practices where transfusion is concerned. Thank you.